Well, I would like to introduce to you Dr. Mejía Rentería from Madrid, Institute San Carlos. And of course, he has an enormous experience in QFR. We are very happy to have you here.
Thank you.
We have seen your presentation during this meeting and also your participation in the different activities here. You've had presentations, posters, very active. And of course, you help us also tremendously with going to other sites, train the doctors how to do the QFR.
Yes.
And what are your current experiences with QFR? How easy does it work in clinical practice? That's where we want to go, of course.
Yes. I think QFR at this point is a very, very great tool for assessment of lesions in patients with coronary artery stenosis. And as we presented in a session dedicated to non-invasive imaging, one of the main advantages of QFR is that you can omit additional risk, additional use of adenosine, additional invasive procedures before or beyond conventional angiography. So definitely QFR may provide many advantages in this field of intervention in terms of defining who lesions deserve coronary revascularization. And at this point, the previous studies supporting QFR had very good results, but at this point I think we need to go on to clinical outcomes studies. So I think probably in the next months or years we were talking about clinical outcomes, clinical decisions made on QFR.
Yeah, and we certainly look very much forward that you can participate also in that study. You will be there in Madrid, so we look forward to have you on board there. Question about if you have multiple lesions in a vessel.
It's one of the subsets in which a QFR has a great advantage. When you have a vessel with serial lesions or tandem lesions, you can select by using the final analysis result, you can find which lesion is contributing more to the drop of pressure in the vessel, and in this term you can decide which lesion you need to treat first.
Yeah.
And additionally, now I know that QFR software has an additional option that is named residual vessel QFR.
Yeah.
That is very great because it is predicting what will be the QFR that you will obtain after treating one coronary lesion between the others. Now, so you can predict the result, which is important for interventions and so on. So in the subset of tandem lesions, QFR has also very, very advantage.
Yeah,
of course.
And of course this is a new feature that we are now also launching, and we still need to validate that also.
Yeah.
But that's where you are the experts in showing that what we present also works.
Yeah.
And indeed, I think because you do as if there is no lesion anymore, and then predict what is the residual QFR basically after the stenting.
Exactly. Yes, it's very useful, and we need to test it. But I'm very positive about this.
Yeah, and then there is lots of further developments in terms of like the bifurcation QFR and all kinds of other things that we will develop and look forward with all your support also to launch that in the next versions. As well as like the outcome, we need to show that it is non-inferior to the FFR.
Yep.
And that is, so far we have been really working on the evidence together with the whole QFR, how do we say it, club.
Yep.
You can say QFR club.
Yeah.
And the evidence is there now. Next step is now how can we create more features and simplify the whole procedure so that it really works in the clinical practice, on the everyday practice.
Yes, sure.
So that is what we are looking forward.
Great.
So I thank you so much for this interview, and we look forward to the further very intensive collaboration in the future.
Thank you very much.
Thank you so much.
Thank you, Professor.